There's a message in the skies and in the streets. Opportunity, the American dream.
Welcome to Friday Focus, August 26, 2016, and I'm going to talk to you about something I've been holding back on you. So a couple weeks ago, we talked about how sometimes we're holding back things on our patients and don't tell them, and there's something I've been holding back on. I've been working on it for a while. In fact, I changed my structure of how I work in this office. I used to do a lot of the production for surgery and for the veins and the consults, and I'm really, backing off on that. I made some changes in my life that I could focus on some other things. And I'll tell you what I've been holding back on you, and then I'll explain to you the kind of things we've done to achieve it and what it's going to mean, to us. So I've been getting ready for 2017, which I'm calling the big year. So what is the big year? Well, it might be like, when you're 11 years old, turning 12. There's different things of big years. It might be when you're getting, married and having a baby. For us in this business, it's when we really kind of lined our ducks in a row, got things in order, and allowed us really to become the practice and the people we were meant to be. And that's even our kind of like how we envision our entire purpose, become the person you're meant to be. And what this practice was meant to be is going to be brought out, at least for starters, in the big year, which is 2017. And I made tremendous investments, both time and money and energy, to achieve the big year. One thing I did is one of my investments was, getting out of seeing the patients as routinely as I did before, getting out of surgery for the most part, because I wasn't able to focus on the things that were going to accomplish the big year. And in reality, if I was still doing all the surgeries, we ain't getting there. And we grew, from 2004 to 2008, with just me being the only provider, grew pretty fast. And then I got to where I hit my capacity. And then I started hiring doctors, and I was doing the same thing over and over again and hiring more people. And the results weren't exactly the same as we opened offices and we scaled up. We kind of got a little distracted, and we didn't do the same thing with every metric. So then just recently I've really backed off on the clinical side and focused on more the business development side, and more importantly than the business development, but I'm working on developing people. And I'm going to offices more and communicating with the staff. One of my jobs is to create alignment in the offices. So I look at my job as I have to create the vision for where we're going to be, and then I got to communicate and align our people. Okay, and that's what I'm doing. So what kind of things have we done to get to the big year? Well, we added all new services of dermatology. That was a tremendous investment of hiring dermatologists and PAs for dermatology and medical assistants for dermatology, and they're kind of getting on their stride. We added services that really didn't exist before, with the stem cells and the PRP for hair. Those are things we did kind of business-wise. Also, I backed off on seeing the clinical patients so I can really focus on creating the big year. We raised the minimum wage to double the national average. We've been raising our bonuses regularly. We're trying to create better jobs for people. We offer, we have a private chef making food. Some people choose to use it, some people don't. We have, the lifetime fitness membership. We have a 401k that some people choose not to use or use. We have health benefits. We're trying to create other benefits for you as well. We increased the maternity leave benefits. And that's really to make you the person you were meant to be, so you can achieve it through your family is as important as anything, and you should have more time with your family, have a baby, and you should be able to earn enough living to take care of them. But that's setting us up for the big year. And what's going to happen in the big year? Well, the metrics that I look at, some people call them KPIs or key performance indicators, and that's just a semantic you don't need to know. But we look at our number of new patients, and they're rising. Number of vein new patients, Mary was just reviewing with me today, in August, they're up double over last year, 100% more than last year. Our surgery in August, consults were up. Our cosmetic consults were down a little bit because we changed the way we're bringing people in. We want to have more qualified leads. So cosmetic surgery consults are down a little bit, but production's up because we're getting better qualified leads, people that really want our services and can afford them and are maybe good candidates for it. HRT, I wrote a book recently. It'll be released in November on hormones, some things we got wrong and misunderstood about modern treatment of menopause. That's going to set up for the big year, so we can actually spread out and impact our community on how women are being treated when they go into menopause. So they just ignore them or give them antipsychotic medicines. We'll be able to give them really legitimate treatments, and we'll actually influence people in our community. And we're going to see that we're going to be able to give away a lot of money in 2017. Right now we're doing some charitable donations. We're kind of just getting it started based on our referrals. And we're really going to kick that up. And I really want to give away a lot of money in 2017 so we can impact, again, our community. I want to see wages drift upwards, impacting in our families and our community. We want to do that through carrying out our brand promise, which is excellence in service, respecting people's time, and giving great results. And I've been working with the different offices to try to get them to sort of align on that thing. I noticed it was sort of, we kind of got away from giving people treatment in a contemporaneous fashion and putting people out for weeks, which obviously you can't deliver results if they're not going to get it done. We all know that. And we talked about things like same-day mapping. Like, that's mandatory. Okay, so if you can't do same-day mapping because of manpower, fix the manpower issues. You're going to restructure and move people around so it can occur. But if we don't do mapping same day, we're not going to get our brand promise carried out. We're not going to hit our big year. If we have patients coming in for CoolSculpted out there and we can't offer it, we're not going to hit our big year. So we're going to be talking about this in the coming months. But 2017 is going to be the big year. Our profits are going to go up. Our revenue per patient is going to go up. Our patient satisfaction are going to go up. And we noticed that we did a survey of our patients' satisfaction at the offices, and Warren's at 100%. 100% patient satisfaction, highest of all the offices. And what are they doing? They're doing things right. They're figuring out how to service their patients in a timely fashion, how to be nice to them. And then in turn, they will thank us by referring us patients, okay? And that contributes to our big year. Other things that contribute to our big year is better employee satisfaction. You know, we won the Cool Place to Work in Michigan with cranes. I want to see that continue and even get better. I want to be the cooler place to work. I want to be the best place to work, particularly for women. I want to have the wages, you know, kind of the highest in our industry, which we're probably there already, but we'll maybe kick that up a little bit more. I want to see it where you have satisfaction coming to work and doing your job, and that's going to lead to the big year. So the big year is a big year for our production, our profitability, our wages, our staff satisfaction, our client satisfaction, and we've been gearing up to this. And you can kind of sense it if you've been here for any amount of time. Some of you are new, and you come here, it's kind of exciting being in a new place. But people that have been here a little while, you realize things clearly are changing, and they're changing with the specific intent to make 2017 the best year we've ever had, and it's coming. Okay, it's coming. And when you see me at your office talking to you about different things, I'm really focused on creating this big year environment. We have a year that's just fan-freaking-tastic, okay? It's gonna be a great year in terms of, like, things are just rolling in well for us. We've invested a lot into it. You know, I've been looking at the metrics on a daily basis. I'm getting reports tonight of how we're booking our patients, and we make sure we get patient success. I've been meeting with the marketing team, the front desk team, the call center team, the clinical teams, to make sure we can kind of get the barriers out of our way that are preventing us from having the best year. And they're going away. They're dropping one by one. We're getting better and better with the alignment in the offices, so you understand what the other offices are doing. Got a lot to do yet, I understand that. I was talking to the marketing team today, and they feel we're not really communicating our marketing efforts to the offices effectively. Well, in order to get the big year, we're going to fix that, okay? And the big year may not be our best year ever, but it'll be best year so far, our biggest year so far. And that's the thing is, once we get to the big year, we probably want to have another one. So I just want to let you know about, you're going to be hearing more about this as the year rolls on, but 2017 is going to be a big year, and a lot of things that we've been doing are steering us in that direction. I want to have the most employee engagement ever in the big year. I'm really focused on frontline leadership. I want the people closest to the problem to make the decisions, not send it uphill to a boss to kind of say no. You already got no. You had no before you asked. You make decisions yourself. I want to have empowerment to our employees. I want to have satisfaction. I want to have better ability to be adaptable and agile and change to the stresses that are thrown at us. You know, we look at maybe an office understaffed one day, another office overstaffed. How do we move that workforce around and accommodate our patients? That's agility. How do we let people make decisions on the front line? I mean, sometimes there's a tendency to want to ask permission for things when you probably are the best person to make that decision yourself. And then you go and ask somebody that doesn't really know anything about it, like asking me about, you know, they're asking me today about something to do with Emma. I'm like, I have no idea. I mean, don't even have a log on. I don't know how to use it. So I'm not the best person to make that decision. So the big year is coming, 2017. You're going to hear me talking about it more. And a lot of these efforts we're doing is to achieve this. We're making investments that are costing us a lot of money and hurting profitability, et cetera. But the idea is to create the big year. It's coming. Look forward to it. Thank you.
This could all be yours someday.